Stress, the root cause of many illnesses. Yet surprisingly, many people don't actively manage their stress. Did you know that stress can also contribute to chronic fatigue? I'm Dr. Joo-hee Kim, a family medicine specialist and director of the Aging Center. Stress is the psychological or physical reaction our body has when faced with situations that are difficult to handle. To fight off this perceived threat, the body begins producing various hormones as a defense mechanism. But not all stress is bad. A certain amount of stress can actually motivate us to give us energy. That's why we categorize stress as good stress and bad stress. Good stress is caused by events like marriage, pregnancy, moving, or the birth of a child. Bad stress is triggered by situations such as retirement, job loss, illness, divorce, death, or overworking. The real issue arises when bad stress is not properly managed and becomes long-lasting. So among the various stress hormones released during stressful situations, the most well-known is cortisol. Cortisol helps the body by raising blood sugar levels to supply energy, repairing damaged tissue, and supporting immune function, digestion, and growth. However, when cortisol is released excessively, it becomes problematic. It can lead to abnormally increased appetite, which causes fat to accumulate around the abdominal and waist. It can also cause indigestion, headaches, insomnia, and fatigue. When you experience stress, not only is cortisol released, but your sympathetic nervous system is also activated. This triggers the release of a hormone you may be familiar with, adrenaline. When adrenaline is secreted in excess, it causes a faster heartbeat and a state of heightened alertness, making it hard to fall asleep even when you're tired. If this continues for a prolonged period, it may lead to emotional instability, a constant sense of fatigue, and even secondary physical conditions such as cell damage, inflammation, and arteriosclerosis. Fatigue is classified into different stages based on how long it lasts. If it's less than 1 month, transient acute fatigue, which typically resolves on its own. But stress, if it lasts more than a month, it's considered persistent fatigue. If it's more than 6 months, it's considered chronic fatigue. It doesn't improve with rest and interferes with daily life. And the longer fatigue persists, the harder it is to recover. To relieve stress-induced fatigue, the foundation lies in improving daily habits, getting enough sleep, exercising regularly, and engaging in hobbies, taking breaks, and distancing yourself from stressful situations. However, once stress and fatigue become chronic, lifestyle changes alone may not be enough. At the Aging Center, we offer a variety of solutions and treatments for patients suffering from stress-induced chronic fatigue. Customized IV therapy to help restore energy, stem cell treatment to support immune function and metabolic balance. Also, we provide a systemic recovery plan tailored to your overall condition. So for modern people, stress and chronic fatigue seem almost inseparable, but if left unaddressed, they can lead to much more serious health issues. If you're exposed to ongoing stress, unable to sleep, and suffer from constant fatigue and a sense of burnout, we really encourage you to visit us and regain your health through care recommended by a specialist. This has been Dr. Joo-hee Kim from the Aging Center. Thank you.